It's now time to hear from two people responsible for crafting the policies needed to improve access and affordability of care. I've got Representatives Tom Reed and Diana DeGette. They're both co-chairs of the Congressional Diabetes Caucus. It's a great pleasure to have you both here. Diana DeGette was the author of the 21st Century Cures Act, which we've discussed so much this morning, and played a key role in crafting the Affordable Care Act. In addition to co-chairing the Diabetes Caucus, Congressman Tom Reed is the co-chair of the Problem Solvers Caucus. He's one of the people I really like, and is a member of the House Ways and Means Committee. We have a lot of problems to fix. So let me start with Congresswoman DeGette, and I'm going to be a little silly for the moment because I just love Christmas trees. Congratulations, Colorado, according to your Twitter, is going to be providing the Christmas tree at the Capitol coming in, and I know folks can go see it in Denver. So, you know, whatever thoughts you have on that. But then I'd just like to ask both of you, you know, in a problem solvers mode, and, you know, I've talked to Fred Upton, many on the Republican side, Congresswoman DeGette, about the importance of that 21st Century Cures Act. We've talked about it today as well, about being the Operation Warp Speed equivalent in a lot of areas. So I'd just like to hear from you both. You know, what needles do we need to move on diabetes that aren't being moved? What problems can be solved as we come into a new Congress?
Well, thank you for having us. And of course, we're always proud when we get the Christmas tree. This is not the first time. What?
Do you ever not get it? Does Colorado not get it?
Well, you know, sometimes we let somebody else have it. But I will say we've had it more than once that I've been in Congress, and it's a big honor. So it'll be fun. I was really proud. You know, I work a lot across the aisle, and I'm really happy that you're doing this bipartisan dive, because I think in the next Congress, and I'll bet you Tom will agree with me, it's going to be even more important to forge these bipartisan partnerships to solve these issues. Fred and I did sponsor the 21st Century Cures Act, and we think that this can be a model of how we expedite research at the NIH and of course at the NIDDK and the other institutes, and then how we approve drugs and devices at the FDA. Fred and I are working on Cures 2.0 right now, and one thing that we hope to include in the next piece of legislation is expedited review by CMS of drugs and devices, because of course if CMS doesn't cover it, then it really doesn't make a difference. And what we've seen in the diabetes realm in particular is a very slow process at the CMS for approving technologies, which really limits the access of diabetics to get the current standard of care. There's a lot more that we can work on, but that's going to be a big focus of the legislation Fred and I are going to be introducing soon in the next session.
Representative Reed, do you agree with that on the regular? Because, you know, part of this, as I look at it, there's the cost side and the patients and focusing on, you know, patient health and what they need. Another part of it is science and innovation. And there are just unbelievable blockages in both of those areas, it seems to me, as an outsider. But I'd love to get your comments on what Congresswoman DeGette just said, and then also see what's on your playbook to understand, because I know that this is personal for you, and would love to know what you think we need to do coming into the next Congress.
Well, I appreciate being here with you, Steve, and couldn't ask for a better partner on the Diabetes Caucus than Diana DeGette. We work so closely and well together on these issues. Both parents of type 1 diabetics have been living with diabetes our entire lifetimes, it seems like, at least our children's entire lifetime. But, you know, what she's talking about is absolutely something we need to do a much better job at. And I think there's bipartisan agreement for it, which is as that innovation, as that science comes through with breakthrough technology and breakthrough treatments, you match up not only getting it approved and reviewed from a scientific FDA point of view, but making sure that the insurance and CMS and the other agencies are there at these takeoffs so that it's accessible to people across the country. And I think we can do a much better job there. I wholeheartedly support what Diana and Fred are doing in regards to that. And we look forward to streamlining that process. But I also, you know, I'm the eternal optimist, Steve, as you know. And, you know, I look at COVID-19, for example, and I try to look at the silver linings out of such a horrific experience that we've gone through as a country. And when you see what we've done with telemedicine during COVID-19, what you've seen, what we've done with accessing some of the innovation and getting it through the red tape in a much better and quicker fashion. I think there's bipartisan agreement that we can build off that success that COVID-19 showed when it came to accessing medicine through technology, through telemedicine, things like that. I think there's an opportunity in the next Congress to solidify that. And that's only going to help, in particular, diabetic patients. When you look at what has happened with losing connection with their caregivers during the crisis, and you know what happens when you lose that connection, especially with diabetic patients. If you don't have that follow-up care, if you're not monitoring those A1Cs, if you're not monitoring access to insulin and things like that, and good nutritional training, you have compounding corresponding comorbidities that start to set in that we can avoid. That's not only a bean counter cost issue, that is a quality of life issue that has to be recognized. So I think there's some opportunity there.
So I'm very worried about ruining the goodwill of our conversation right now by asking you both about health insurance. But another important dimension for a lot of people who have this chronic condition is that a lot of Americans, let's just presume they have health care. A lot of them have high deductible. And when you kind of look at the anger of a lot of Americans with whatever conditions they may have, they in some ways saw what they saw with the expensive price of drugs, but it got conflated as well with high deductibles. Is there any chance that the parties can come together and look at safe harbors on some of these necessary drugs in a way that can escape some of the drama, if you will, of what's happening with the increasing costs of out-of-pocket expenses of Americans with diabetes? Let me start with you, Diana, and then jump to Tom.
Sure. Well. So I don't think that having affordable health insurance should be a partisan issue. I think Tom and I will both agree that we need to make sure that people who have that health insurance can afford it. So I know we'll have conversations about what to do about these high deductible plans. In the meantime, Tom and I have a bill, which I expect we will reintroduce in the next Congress, and it's getting momentum, the Insulin Price Reduction Act. And this is a bipartisan bicameral bill that's targeted at reducing insulin prices so that everybody can get their insulin. Almost every family who has someone who's diabetic knows what it's like to have a high insulin bill. And the way that these prices have increased in the last number of years is just unacceptable. And so I actually think as we talk about insurance that people can afford, if we talk about affordable prescription drug prices, this is actually a bipartisan sweet spot. And Tom and I both think that we could use this as a jumping off point to get really meaningful drug pricing reform.
God, you boys are so reasonable. This is Tom.
It's beyond belief.
Tom Reed, I thought I was going to be breaking up the fun here, but because what I'm hearing from you is that there's a lot of consensus about trying to address these costs. Because I just see, and I do a lot of these programs about healthcare costs, and I know there's an ecosystem of folks with a mix of white hats and black hats in that mix in terms of how a drug gets a price. But I'm interested in what you think we need to do with people who are feeling very, very high out-of-pocket expenses for these life necessary drugs. Tom?
Steve, I couldn't say it better than there's a lot of agreement here that Diana and I have worked together for years on, and it was the Diabetes Caucus, if you recall, that did a 2-year study working together behind the scenes on PBMs and pharmaceutical companies and really pulling the curtain back and bringing sunshine as to how those negotiations work and how folks that get the rebate benefits, it doesn't really work its way all the way through to the end patient, to the end user of the system. And so there's a lot of support for trying to hold accountable that pricing structure that we've created. And some would argue, and some rightfully so, that what we did is we created a market, a system that had the unintended consequence of having all these perverse incentives to have all these list prices just go through the roof because there's no cost containment strategy. There's no benefit to negotiating truly down the prices. The benefit is all by negotiating the prices up by all the people in the room negotiating and setting these prices. that report, I think, started this conversation on drug pricing in a way that set the stage for the bigger question that Diana and I are always wrestling with, and that is how to get drug prices down, how to get access to those drug prices or those drugs in an affordable way. And there's a lot of agreement here that when we talk about rebates, for example, passing those rebates to, I'm working with Senator Wyden as well as a bipartisan effort there, passing those rebate benefits, not to the pharmaceutical and the PBMs and the pharmacies themselves, but to the patients, having them be the benefit of those dollars. And, we've been talking to a lot of the diabetic patients out there, because we put this sunshine on this whole area of insulin pricing. I was just on the phone with Lilly yesterday, the USA director of insulin. Each one of these manufacturers have programs now where they cap the out-of-pocket expenses, and Lilly is $35, consistent with the federal standard that came out from the administration, so that we can get insulin delivered to people at no more than $35 a month out-of-pocket expenses. That is a good move. Now, I told them we need to raise awareness. We need to make sure people are aware that that's out there and get more access to it. And that's obviously something that they work with us on, but they don't want to go too quick there.
I want to ask you sort of a naive kind of, out of left field question before we go to the audience. We have my friend Marty Bell, who's been very supportive and helpful in today's event, who wants to pose a question. But you both have children with type 1 diabetes. You're both in the helped lead the Diabetes Caucus. You believe in science. I didn't know, and I said this at the beginning of the program today, I didn't realize how prevalent and how large a footprint diabetes was in my circles, in my neighborhood, among my friends, even in my family. It just wasn't something I was aware of. I am now much more aware of it, and I confessed my ignorance to a lot of this. But I am interested in what you do to generate empathy among your colleagues, understanding among your colleagues about the priority and importance of this. If one is not aware that just around them, if they scratch beneath the surface of their friends, their community, their broader family, that this is out there in ways that they might not even understand. Because, I understand people who experience it for themselves. But if they haven't done that, how do you kind of bridge that lack of awareness and understanding among your colleagues? Diana?
Well, let me just say, the Diabetes Caucus historically has been the largest issue-based caucus in the U.S. Congress, well over 300 members, because every member of Congress is touched by diabetes in some ways, type 1, type 2, pre-diabetes. And so the Diabetes Caucus spends a lot of its time educating our members about different issues, but it's also why we get the power to do things like pass the Special Diabetes Fund, which has funding for type 1 diabetes and also type 2 diabetes research among Native American populations. I'll just tell you a quick anecdote. I think that most of our colleagues know now that Tom and I have kids who have type 1 diabetes. And one time, we were having a hearing in Energy and Commerce, and a witness was talking about, we were advocating for the low blood sugar, low glucose cutoff insulin pumps. And a witness was testifying about how sometimes if people's blood sugar drops really low at night, they die. And she says, we call this dead in bed. About members came running over to me, including Republicans and Democrats, and they
we may be losing Congresswoman DeGette.
And just a few minutes later, the pump was off. So, just know really help the members of Congress understand it. I'll just quickly put in a quick commercial plug here. This is what we lobby as a cause. And here, we really need the continuity of research.
Congresswoman DeGette, we're having a little bit of trouble. I'm going to come back to you in a moment to do your commercial plug. Let me ask Congressman Reed just for a quick comment before we go to our question.
Yeah, no, being the father of a type 1 diabetic gives you that personal experience that you can go to members, because we hear it all the time.
Sure.
We still get people like, oh, they'll outgrow it, or, haven't they cured that disease? Haven't they figured out a way that you can live with diabetes and it's not a problem? And it just reinforces the need to raise awareness on the issue and raise awareness that, diabetes, we do want it to be a thing of the past. We do want it to be a historic footnote where we celebrate the success of curing it, but we're not there yet. And we tell the story. And once you tell a fellow member about your son or your daughter or a personal experience, I will tell you, it carries a lot of weight to those members because now they see you in a different light. And it also gives you credibility on the issue that I think other members maybe don't have as much of a credibility.
Well, I'm glad to hear it because I do think awareness is part of the game, and I'm glad you're doing it. Diana, you went out just as you were offering your commercial plug, and I want to give your commercial pluggee that opportunity. Go right back to it.
I was just going to say we need to reauthorize the Special Diabetes Fund for a 5-year period, because we have to have the continuity of research. We can't just keep doing short-term fixes. And I think with the numbers that we have, we should be able to do that.
Well, thank you. Let me go to Marty Bell, a question from Marty, who was helpful today. Marty?
Hi, Steve. It's Marty Bell. I'm the father of Olivia, who has T1D. I'm also a huge fan and supporter of JDRF and, like Congresswoman DeGette, a proud graduate of NYU Law. I have a question about the special diabetes program. I'd like to know how we get back to funding it for 2-year increments. While the continuing resolutions of 3 and 6 months are certainly appreciated, they're really inadequate because scientists and labs require some certainty of funding if they're going to do the research that we all hope is going to someday, hopefully soon, get us a cure for type 1. Thank you.
Representative DeGette, I should have had Marty ask you the question before you said that, but any more thoughts on the Special Diabetes Fund?
Right.
I think we've lost Diana, so let's go to Tom Reed. Congressman Reed?
Yeah, I think you're absolutely right on to it. And Diana and I totally agree. Oh, did she come back? I totally agree with that.
I guess we are. Well, I just want to thank you both. I think we're right at the point where I think we're all in vigorous agreement. And thank you, Marty, for that question. Diana, I see you there and you look great. Do you want to add a final comment because you got cut off because of the bandwidth, and I apologize.
All I wanted to say is it's a top priority of ours to reauthorize the Special Diabetes Fund. Also, excuse me. I just learned it's Tom Reed's birthday. So happy birthday, Tom.
Okay. Congressman Reed, happy birthday. I want to thank you both, Diana DeGette, Tom Reed, members of the Congressional Diabetes Caucus. I hope you'll come back and talk about this. And as I told really excellent panelists earlier, I hope we can continue to come together and talk about the importance of this, but also mark progress or mark lack of progress, because I think what you're doing is so important. Thank you so much for joining us today.
Thank you, Steve.
That brings us to the end of our program today. A big thank you to the Diabetes Leadership Council and Diabetes Patient Advocacy Coalition for their support, and to all of you attendees for joining us for this set of important discussions. If you missed any of the conversations, we're going to have a video up shortly of the event, and you can go to our website this afternoon. For those interested in continuing the discussion, join us in just 1 hour at 2 p.m. Eastern Time for Technology and Diabetes Care, a fascinating look at how technological advances are improving the quality of life for patients. With diabetes, I'll be there. I'll be joined by Representatives Michael Burgess and Robin Kelly. You'll find more info on thehill.com/events. It's not too late to sign up for the live stream, or you can just watch it. I shouldn't tell you that, but you can just watch it as well. Until then, I'm Steve Clemens. Be well.